Hi everybody, I'm Dr. Michele Drake here, and I'm at the Drake Center, and I was here today to just talk to you about some questions lots of people have about vaccinations. And with me today is my trusty assistant Nicole, who's going to ask me questions, and I'm going to answer them, and hopefully that helps clarify information for you guys about the importance of vaccines.
All right, Dr. Drake, what exactly are dog vaccinations?
So dog vaccinations are injections that dogs are given in a series starting out with puppies. And it goes through the dog's life, and it depends on the dog's lifestyle and the dog's age, obviously, as to what types and how many vaccines we're going to be giving. The purpose of vaccine is to introduce very small amounts of a virus particle that causes the body to create an immune response that allows the body to be protected, so that if it were exposed to this bacteria or virus, the body would be able to mount an immune response and never become sick from that. So vaccines are super important.
All right. So how do vaccinations impact the health and well-being of my dog?
So I'll tell you a little story. Back when I first got out of veterinary school, parvovirus was sort of new, and we had actually a parvo ward in the hospital that I worked in my first year out of school, and it was full of animals who were incredibly ill. Think kind of like the Ebola virus. That's what it's like for dogs when they get parvo. They're extremely ill, and at the beginning we didn't even know how to treat it. It took a while to get really good at doing that, but anyway, it's a really bad disease. So the purpose of the vaccines are to make sure that your dogs don't experience that, or rabies, or distemper is another disease that's fatal. A lot of puppies can be exposed early on if they're not vaccinated. These diseases are horrible for your pets to go through, and they're completely preventable.
Okay. Are vaccinations required by law?
The only vaccine that is required by law is rabies, and that is because it is a zoonotic disease for humans, that it is fatal for humans if they contract rabies. So we do want all dogs and cats vaccinated for rabies. Some states actually require both dogs and cats to be vaccinated. Some states just require dogs, but really all dogs and cats should be vaccinated for rabies because it's contracted from many different wildlife forms. In California, we have bats that can transmit rabies to dogs and cats. In many other places, a lot of mammals can carry rabies. So it's an important disease to vaccinate against.
Okay. Does my dog's lifestyle factor into what vaccinations my veterinarian will recommend?
For the most part, there's a core set of vaccines that we recommend for all dogs: parvo, distemper, rabies. But there are some other vaccines depending on if let's say I have a dog that's going to dog parks or to boarding a lot, then I'm going to recommend, in addition to Bordetella, which is kennel cough, we may also recommend the flu vaccine. There's a vaccine for leptospirosis, and that is also a zoonotic disease, and it's transmitted by the urine of wildlife. Rats especially can be the contagion sort of for animals contracting, dogs contracting leptospirosis. So some dogs may be a little, if you live in a high rise, the chances of being exposed are much less. But really a lot of dogs can be exposed to lepto. But there again, it just kind of depends on the dog's lifestyle as to which other vaccines we're going to recommend.
How soon should I get my dog vaccinated?
So the most important for puppies is, there's always a confusion about that, is I always tell people when you get your puppy, which is usually should be 7 to 8 weeks, we want to start vaccinating because puppies are unable to mount a long-term immune response until they're about 4 months old. So just regardless of what age you get it, a puppy should be vaccinated every 3 weeks until they're 4 months of age, which is the time when they're able to mount a long-term immune response. Otherwise, most dogs are going to need something once a year, and there are some boarding facilities that require Bordetella every 6 months, and those dogs may need to be vaccinated every 6 months if they're boarding frequently.
Do I really need to avoid allowing my puppy to socialize with other dogs until they are fully vaccinated?
This is such a misconception, and one that really bothers me because it's so important for puppies to begin socializing at 8 weeks of age. So I tell people your dog doesn't have its complete set of vaccines, but it is vaccinated the second within days after getting its first set of vaccines. Puppies have immunity from their mom while they're nursing, and once they're done nursing with their mom, we want to start the vaccines so that they can have small doses of vaccine that would allow them to start building up a long-term immune response. But in the meantime, they are vaccinated, so they can go safe places like puppy classes and places where they can socialize with other young dogs and puppies. So it's important for dogs to get out early on, and we don't want that to be the reason. So they are vaccinated, they just are unable to mount the long-term immune response until they're 4 months of age.
Okay, that's really great information. Why is it important to avoid missing a dog vaccination?
So the thing about vaccines is they, just as we know with people, we all get vaccines too. There's an average amount of time that's been studied as to how long the vaccine lasts. And if you go past that, certainly in puppies, it's extremely critical that we stay on the schedule, because if you go much past it, then they are not completely covered and they can pick up bad diseases. So the same with adult dogs, but adult dogs are able to maintain a much longer immunity time. So it just really depends on the age of the dog, the situation, but we don't want to miss their vaccines.
Okay. What are the typical puppy and dog vaccination schedules?
So again, for puppies, it's going to be every 3 weeks until they're 4 months, and sometimes a little bit later than that too, depending. We may add lepto on at the end, and that's a series of 2 the first year. For dogs, we generally want to see dogs every year for the importance that is so important for an annual exam for so many reasons, but also at the Drake Center, we like to spread out the vaccines like once a year, so that you're not getting all the vaccines every year. And so that way, it's a little bit easier on the immune system, and it's just a good thing just to add into the once a year visit. We'll assess where we are. Things change for people. They may not have been going out hunting, with their dog initially, and then they decided they're going to be doing that, and we may want to add in leptospirosis if they enter an area where that goes on. So it's really important that we catch up with you once a year and check in and see what the needs are and base it off that.
Okay, last question. What diseases are prevented with vaccinations?
There are many diseases, so parainfluenza, parvovirus, distemper, rabies, bordetella, which includes several different upper respiratory infections, leptospirosis, probably missing one, but that's most of them. And so it is super important. I mean, people quite often think they don't see these diseases, and it's because we keep dogs vaccinated. If we stop vaccinating dogs, these diseases will come roaring right back, so we really want to keep up on them. So if you have any questions about vaccines, make sure you give us a call at the Drake Center.